Hi, my name is Amanda Loza. I'm a behavioral health educator with the Keep It Off Medical Clinic. What am I going to be eating when I'm on the Keep It Off program? So we actually have, just like this, meal replacement packets that people consume when they're on our program. And we have a lot of variety. We have puddings, we have shakes, we have soups, we have different formulations of the meal replacement packets. So a nice thing about this program is that you know that you're going to be getting a consistent kind of even flow of nutrition, since each meal replacement packet is chock full of not only kind of a perfect blend of macronutrients, so fat, protein, carbohydrate, but also it is going to contain all the vitamins and minerals. So we usually will tell people that it only takes 3 meal replacement packets a day in order for you to get to 100% of your vitamins and minerals for the day. And this is going to be a low carbohydrate diet, so they are carbohydrate controlled, although they still have carbohydrate content in them. So there are quite a bit of flavors to choose from. We find that people usually don't have a hard time finding flavors that they really enjoy, whether that's sweet or savory. Can I do this program if I have a pre-existing condition? So it's very common for us to get people in the program who are seeking out our services because they have type 2 diabetes, they have some kind of a heart condition, and they want to better their numbers, so to speak, in terms of their lab work and just their readings by doing a program that has got structure with calories and carbohydrates. So I would say that, of course, it always depends on the doctor visit, you meeting with one of our nurse practitioners or doctors to see if you are a good candidate for following a diet like this. But I can say from experience that many patients enter this program and weight loss is actually not even on the top of their list for what their goals are. It's not uncommon for me to hear patients say that they entered our program because they were actually wanting to better their diabetic condition, they're wanting to wean off certain medications, they're needing to lose weight in order to qualify potentially for really important surgery. And so they are using this program as a form of kind of diet control in order for them to achieve those results that will then put them in a much better position for where they're at with medication management, and also their ability to potentially hop into a different space, medically speaking, with their primary care physician.